Hello, friends. Hi, this is Dr. Vinayak Rengan here, and I'm the founder of Search Test. And today I'm very delighted to have with me Dr. Yash Patel. He's ranked 4 in INI SS Urology, and it gives me a huge amount of pleasure to welcome him here. Welcome, Yash.
Thank you. Thank you, sir. It's
So, कैसा
honor
लग
to
रहा
be here.
है? Yeah. So, how do you feel, man? कैसा लग रहा है?
Sir, I felt great. Actually, मजा आ रहा है मतलब after giving the exam and waiting for long period before result, it was kind of like stressful environment. But after getting result, I'm just relieved, sir.
Great, great, yeah. Yash, tell us a little bit more about yourself. How did your surgical journey start, and why specifically urology?
So basically, sir, I was the student of 2020 batch, the COVID batch. I joined my MS.
Okay.
And at that time, I was not quite sure about the which super specialty I'll be taking, but I had heard from my one of the seniors that urology is basically the like branch which is not touched by the general surgeons, and it has got a very good work-life balance. So I developed interest in the urology after the my second year and at the end of second year, sir. So I started
Were there
reading
any
something.
specific mentors who kind of said कि यार देखो यूरोलॉजी करना है करके और any specific one or like अपने आप इंटरेस्ट आ गया?
एक्चुअली सर आई गॉट एन एल्डर ब्रदर जो अभी यूएसए में रेसिडेंसी कर रहा है सर्जरी की. He did
Oh,
his
fantastic.
surgery from KM. So he told me if you want to come to USA or do some fellowship, I can recommend from the same college. He has very good relationship. So he told me to go with the urology rather than the general surgery pathway. So
Absolutely, because I think you might have used the Search question bank, right?
yes,
And
sir.
it was created by Dr. Dheeresh. And Dheeresh did his urology over here, both DNB general surgery and DNB urology, and he created the question bank while he was preparing for DNB, the NEET SS. And now he is going to the US.
Yes, sir.
He's going there for a fellowship at Florida.
And
Um,
my brother is also there, sir. Miami, University of Miami. Jackson.
exactly. I think that's where he's also going.
Yeah.
So I think you have a deep connection with Search Test and urology, I guess. I mean,
Sir,
that was a whole new coincidence overall. So yeah,
actually,
tell us a little bit more about your preparation. How did you prepare?
sir, I was not quite sure about my institute preference. I was initially trying to give the NEET SS, but at that time I was not very much into the reading and everything. I was just playing casually cricket and wasting the time.
Uh,
So in the April session, around 22 days were left, and my friends told me that you should go with the aims. Try, just give a try. At that time, I take the test question bank and I read the notes which were available with me. So I solved almost 12 and more than 1200 MCQs and made a
Fantastic.
concise notes from the topics, because at the post MS level, it is very difficult to read all the topics from the Campbell, which is not
नहीं
going
नहीं
to
नहीं,
possible. So I just applied that principle that I will solve the MCQ from the cert test. I will add up the very important topics in my notes and I will revise. At that time, sir, I was qualified in the part one MCQ session, but I made a mistake in form filling, sir. I wrote down my birth date 1966 in place of 1996,
Oh God, man.
which I get to know about after the result came and my result was showing 00, like disqualified. So I told my one of the friend who was doing senior residency at AIMS Delhi. He went there and asked, and he told me like, "Man, you made a huge mistake." But I was like, "जो भी लिखा होगा किस्मत में वो अच्छे के लिए हुआ होगा." तो
सही बात है यार. और तेरे आपके जैसे फ्रेंड्स तो सबके लिए चाहिए. ये तो हमें
हम्म,
समझ गए जो जिस जिन whatever whoever friends told you to write the exam. I think that
हम्म,
makes a hell lot of a difference overall.
yes, sir.
Like,
देन इस सेशन में उसके बाद सर देन आई started preparation around 1.5 month before the exam. I read general surgery quite good this time because it has the weightage is around 30 questions. So I don't want to miss on the general surgery question. Then I read urology for 30 days, solved the MCQ, revised the content, and it was quite good exam this time.
So what was your review of the search test question bank for urology?
It's pretty amazing, sir, because it contains all the important topics in a concise manner, sir. If you solve the 30, 40 MCQs from each module, each topic, it will cover up the most of the questions. I had reviewed the questions, and I was able to get into more than 50 questions from the, like, contents was similar in the exam paper. Around 5 to 6 questions were little bit difficult, but it was difficult for all, I guess. So
Okay.
I grade was very good.
Yeah, so I think that's amazing, Yash. I think the way you've been able to do it. So the urology INISS, what do you think are the important topics which every student should revise, both from the theory perspective and from the interview perspective?
So basically the stone disease, sir, the renal stone, then the uro-onco has very heavy weight, sir. Every topic, every uro-onco part, they will ask a single question or double, maybe twice or three question.
Hmm.
Prostate, prostate is very extensive, but somebody has to read the prostate thoroughly, sir, because they can the trials, the questions on trials, majority comes from the either prostate or from the bladder carcinoma, sir.
Mm-hmm.
Then transplant, basic transplant, they don't ask much deeper into the transplant, but transplant should be read at least once. Then biostat, apart from the urology, I would suggest to go through the biostat basic before the exam, because one or two questions
हो जाता
are
है
there.
उससे तो हो जाता है yeah. I think you've given a very good idea about how to approach it. Were there any image based questions in the interview?
Yes, sir. Image-based question. There were two questions. One was the city image, and another was the, sir, stone stagon calculi was there, and
Hmm.
one drug was there. Basically, the BCG vaccine was kept. So the question were asked, what is the, and actually my interview did not well. At जो starting था मेरा, I was the fourth candidate, I guess, and I was pretty nervous. So I made a mistake in the one question was from the seminomatous germ cell tumor, which has lung metastasis. So I fumbled little bit, but it was okay.
हाँ, वो टेस्टिकुलर कैंसर्स तो यार लाइफ में एमबीबीएस जैसे पढ़ रहे हैं बट कभी याद तो रहता है
एक्चुअली उस टाइम पे सर थोड़ा नर्वस हो गया था, बाकी बाद में जब इंटरव्यू खत्म हुआ तब रियलाइज हुआ, यार मैन आई मेड अ मिस्टेक।
नहीं नहीं ये तो होता है यार। मेरे को याद है मैंने एमबीबीएस में पढ़ा था। उसके बाद एमएस एंट्रेंस के लिए पढ़ा था। पीजी के लिए पढ़ा एमएस पीजी के लिए। उसके बाद नीट एसएस के लिए पढ़ा था। एमएस फाइनल एग्जाम के लिए पढ़ा था। और अभी एमसीएच फाइनल एग्जाम है मेरे 1 महीने में पीडियाट्रिक सर्जरी का। तो उसमें अगेन आई एम रीडिंग टेस्टिकुलर ट्यूमर्स एंड इट अगेन फील्स लाइक एवरीथिंग इज न्यू सो यस you it's very difficult to remember it, but yes, I think you've done overall a good job, Yash, and I'm really proud of you. I think you've been one of our most sincere students. You
And
have
one more thing, sir, in the interview they asked me in the beginning to show me the room, so I would give the advice, just clean your room before the interview.
oh, they wanted to see your room.
Yes, they asked me in the beginning, they suddenly the
Was it
camera.
so it was an online interview.
Yes, it was the online interview, and in the beginning they asked me, "Hey, show me your face, show me your room, what is behind your curtain and everything." So, and after that
So they
they
don't
asked,
want you to have books around or anything of that sort, essentially.
हाँ, और थोड़ा वो एक्चुअली क्या हुआ था, एग्जाम के अगले दिन मेरा एक दोस्त है नीलेश करके, तो ही वाज आल्सो डूइंग यूरोलॉजी, बट वो क्वालिफाई नहीं हुआ था, बट उसने थोड़ा रिसर्च किया था। तो द डे बिफोर इंटरव्यू ही कॉल्ड मी एंड टोल्ड के डोंट बी कंफ्यूज, डोंट बी नर्वस, जस्ट वेयर गुड ड्रेस एंड क्लीन योर रूम। एंड आई वाज लाइक, यार रूम क्यों क्लीन करना है, पीछे बैकग्राउंड अच्छा रखेंगे। नहीं, उसने बोला कि नहीं, क्लीन कर देना, ऐसा सुना है कि पूछते हैं देखते हैं, तो हो गया।
No, this is a very useful tip, buddy. This is a very useful. Okay.
एक्चुअली जिस हिसाब से सर इंटरव्यू गया था, उस हिसाब से मेरे को आई वाज लाइक क्वाइट नर्वस कि भाई अगर शायद इंटरव्यू में मार्क्स नहीं आए तो, एंड मेरे आई हैव एक्चुअली 14 marks out of 20, which is below the average, because most of the toppers has got around 17 and 19 marks in interview. So, but
Ultimately,
I'm
both
getting
us,
the
yeah. Ultimately, now that you've gotten a seat, I think that's amazing.
Mhm.
Um, Fantastic, Yash. I think we're very proud of you.
Yes.
Uh, is there any advice you would like to give students who are preparing for INSS Urology?
Uh, First thing, INI exams are quite good if you prepare 3 months, 2 to 3 months. They are basically subject special, so you don't need to read about the other subspecialties. It's a advantage. And second, if you be confident, like whatever be the result, don't worry about the result. एक बात है, if you are not confident about yourself, if you don't accept yourself as the resident in that specialty, nobody is gonna accept. So you have to think like ये सीट है, ये मेरी है, मैं जा रहा हूँ, बाकी देख लेंगे.
A body attitude, yeah, right? It's amazing talking to you, man. You are a fun individual. To be honest, I wish I'd met you much earlier in my life. Good, Yash. I think we're really proud of you.
So this
I,
positivity is brought up by my fiance. She is like a believer of visualization and positive thinking. So she used to tell me that every night you go to sleep, you just think about yourself working in the AIMS department on a regular basis, urology.
Manifestation, manifesting. Amazing,
Manifestation.
man, amazing. I think one thing what I have learned from you personally is surround yourself with good friends
Yes, sir.
and good spouse. I would say that matters a lot.
Lot.
Hey, Yash, I think it was amazing talking to you. Thank you so much. Hope to see you really excel in life. Hope to see you in Miami soon as well.
Yeah. Thank you so much, sir, for the platform. Actually, I personally think it is the most cost-effective way for approaching the INISS because at around 2500 we are getting the 3 month subscription for the MCQ. It is quite amazing and excellent content, sir.
Thank you so much, man. This means a lot. Thank you so much.